Hey everybody, welcome back to Just Around the Corner. My name is Sarah, and today I have with me Sarah Chancellor. She is one of the physical therapists at Rise Physical Therapy, which is a locally owned business here in Northwest Arkansas. So super excited to have you here today and to get to know Rise Physical Therapy a little bit more.
Yeah, well, thanks for having me. I'm excited.
Yeah. Well, just to get started, okay, tell us about what you do and Rise Physical Therapy.
Yeah, for sure. So, a little bit about myself. I am a Springdale native, so born and raised in Northwest Arkansas. I actually did my undergrad degree at Oklahoma State University. So, my undergrad degree is in nutritional sciences, and then started PT school back here in Fayetteville at UAMS. So, did the doctorate of physical therapy program, graduated in 2018, and then jumped straight into working in outpatient orthopedics, but also jumped into an orthopedic residency. So I finished that in 2019 and then sat for the orthopedic specialist certification in March of 2020, literally like 2 weeks before
Wow.
the world shut down.
Oh my gosh.
So that was kind of a wild time, but I'm very glad I got that test in and out of the way.
Yeah.
Yeah, very fun time. So yeah, have been treating in outpatient PT for about 6 years now, which is fun. And then kind of a little bit fell into the pelvic floor world. So I treat a mix of orthopedic and pelvic floor, which is really fun. I love it. So yeah, Rise PT is like you mentioned, locally owned small business outpatient orthopedic practice where we pretty much treat everything, anything and everything orthopedics we can treat. We are one of the bigger companies for treating pelvic floor dysfunction. So thankfully that realm is growing in Northwest Arkansas now. When I first got out of PT school, there was one place here that you could get pelvic floor PT. So
Wow.
thankfully it's growing. And we are thankful to have like 6 pelvic floor PTs within our company. We've got someone at all of our locations, which is super convenient,
Yeah.
really helpful for our patients. So I also, outside of patient care, I am the director of education and clinical development for our company. So kind of what that entails is I help with recruiting, hiring, onboarding, continuing education. I started a mentorship program for our new grads that I take everyone through. So just trying to make sure that all of our staff at Rise are staying up to date with what's current in the evidence and staying up to date with treatment options and just continuing to develop our clinicians to make sure we can offer our patients the absolute best. So kind of dabble in a little bit of stuff, but that's kind of us in a nutshell.
Wow. I mean, basically what I gathered in all of that is you guys are really legit.
We
You're
try to be.
very qualified, very well trained, and you guys are providing very informed and comprehensive care for the community, which is amazing and so needed. And
For sure.
I love that you guys are bringing pelvic floor therapy to the community and just seeing how that's grown, even just when you
Mhm.
first started in the area. And you mentioned that like you have a lot of different arenas that you serve, just the community and people who are also practicing and needing training, needing mentorship, which is so
Right.
cool. But one of the things that you said that you really focus on is pelvic floor therapy. And just for those who've never done that or don't really know what that is, can you talk a little bit more about what is pelvic floor therapy?
Absolutely. So I think pelvic floor is one of those, yeah, very underserved body regions. And a lot of times it's because, especially here in the South, people just don't like to talk about that kind of stuff. And so I'm super thankful that I think, social media has actually really helped get the information out and kind of normalize some of these things. So, what pelvic floor PT looks like is we still have all the basic training of general orthopedics. So we look at things like the low back. We look at things like the hip. We look at things like your jaw and your feet because the whole body's connected. So we kind of look starting from an orthopedic perspective, and then we dig a little bit deeper into pelvic floor. So some of the common, diagnoses that we might see in one of our patients or one of our clinics is pain with intercourse, just general pelvic pain, pelvic organ prolapse, urinary incontinence, fecal incontinence, gas incontinence. So many things that I think a lot of people just don't know are common issues that people can have. And so a lot of times people are like, oh, I just thought that was normal. I'm just not going to tell anybody about it. Or like, I'm embarrassed to talk about this. Um, but the beautiful thing about pelvic PT is that so many of these things can be addressed, and we can do a lot of things to help with that. Some other things that we tend to see in the clinic are things like endometriosis, PCOS, fibroid issues, different things like that. So helping those patients manage their pain. And we'll probably get into some of the more like nitty-gritty details on all that fun stuff here in a little bit. But yeah, I think it's really fun because once a patient actually comes through our doors, they're like, I didn't know I could get help with this. And like, it's game changing. It changes their life. It changes quality of life and how much they're able to function. So a lot of people feel really terrified starting pelvic floor. But then once you actually get there, you're like, oh, this is just another body region. It's the same type of muscle as like my shoulder. And it's not a shame, like it's not a shameful thing to get PT for your shoulder, nor is it a shameful thing to get PT for your pelvic floor. So
Yeah.
um, it's really fun. There are some aspects of it that people are like, oh, well, is it like if I go to the OB and I have to do an internal exam? Sometimes an internal exam can be helpful,
Mm.
can give us a lot of really good information and get really specific to what's going on with your issues. But our number one job as pelvic PTs is to make sure all of our patients feel safe.
Mm.
So if there's something that our patient doesn't feel comfortable with, we're never going to force something on someone. So I think that's something like kind of a like misknown information of like, oh, what's just going to be this really awkward, uncomfortable situation. It's like, no, it doesn't have to be. It shouldn't be.
Yeah.
So yeah, that's kind of pelvic floor PT.
Man, I love that. That's so good. And I main takeaways from what you said is that it's really we're coming alongside patients and we're really wanting to make sure that they feel safe, that they have
Mhm.
agency and autonomy to choose what happens to their bodies,
Yep,
and to have a say in their care, which is so important.
for sure.
And to have people who are providing care advocating on behalf of their patients like that is incredible. And we need more of that. And so I
For
love
sure.
that.
For
And
sure.
I love that you gave some examples of what would be reasons to get PT,
Hmm.
specifically for pelvic floor. And I think even just for myself, before I ever engaged in any physical therapy for myself, there was this concept of, oh, that's for people who are like in athletics or they've like severely injured themselves and the
Like
doctor
had a
has
surgery or yeah, yeah,
yeah,
yeah.
right. Yeah, yeah, yeah. It's like unless a doctor has told me I need it, I probably don't.
Which is wild because they've actually come out with quite a bit of research saying that I think the numbers are upwards of like 68% of people will experience some sort of back pain in their lifespan, and only like 25% of them actually seek care, which
Wow.
is crazy. It's like you don't have to live this way.
Yeah, yeah. Well, it makes me think of even just in the counseling world, like we treat our bodies in every sense of the word. Um, really, we only take care of it when something is screaming at us. When
Right.
really what I'm hearing you say is like, you don't have to have something screaming in order to be curious and have somebody check in on it and give an
Okay.
added set of eyes to what's going on. Um,
Hmm.
and a big thing that I've learned too is a lot of times with trauma, the response is to mute
Right.
and really kind of not listen to our body's cues. And so a lot of what
Hmm.
your work is saying, no, let's pay attention. Let's see what our bodies are saying.
Right.
And we might discover something that we didn't even know was there that is telling us it needs our attention. And so
Oh, for sure.
that's really
A
awesome.
thousand percent.
Yeah.
1,000%. And I think the interesting thing, especially with PT, it's definitely developed in the last probably 10, 15 years. So now it is a doctorate program. And
Mm.
so what that really means is that in Arkansas in particular, we have what we call direct access. So you don't even need a physician referral to go see a PT. So if you're like, yeah, something just doesn't feel right, like I'm having a hard time with this functional movement, or I just want to be like preventative and make sure I can keep doing the things I want to, you can just call a PT clinic, say, "Hey, I think I want to get assessed," and we can do it, which is awesome. Yeah, so I think it's one of those things that we're trying to get more information out to people because a lot of times people don't know you don't have to go to your doctor's office, and so the thought of being like, "Well, I have to call my doctor's office. They probably can't get me in for a month or 2, and then they'll send a referral, so it's gonna be 3 months before I can get in," and then, like, it's not even worth it because 'cause I'll probably feel fine by then. And
Right.
so I think it's nice knowing that, no, you can just kinda call up a PT clinic and say, "Hey, I think I need help. What can we do?" Um, yeah, so it's super fun. And I think our healthcare system right now, even from, like, my own insurance perspective, like, my insurance won't cover mental health services until I totally hit my out of pocket. I'm like, "Well, I'm not an unhealthy person. I don't have to go to the doctor often. Like, I rarely meet my deductible, but you're not gonna let me go see a counselor?" Like,
Right.
and so I think our insurance and just the way our healthcare system is set up is that it almost, like, puts that information into patients' minds of, like, yeah, this is only for some, like, if something is really wrong, do I need to go get PT, or, like, I don't wanna pay for that, or I don't know if insurance will cover that, so we're just not gonna do it. So I
Right.
think a lot of it is just getting the information out, and even to primary care doctors or OBs, a lot of times they don't even think to send their patients to PT. They're like, That's just normal," or like, "Here's some pain medication." So,
Right.
it's
Yeah. Well, yeah. I mean, what you're saying about insurance, like we could have a whole other
a whole other
podcast just
conversation.
dedicated to that because there's a lot in that.
Yeah.
But I also love what you're saying too of just, this isn't just symptomatic care. Like we're going to
Mhm.
the source, we're going to treat the symptoms, but we're
Right.
going to find the root cause, and there's even preventative measures that we can take of
Mhm.
it doesn't have to be something wrong in order to go
Right.
to physical therapy.
For sure.
This is part of just living, and maintenance is
Taking care of
and
yourself.
right, which is a huge paradigm shift, especially
Mhm.
what you're saying of like insurance primes us to think that we need to have something screaming at us to get care.
Right.
Otherwise, we're being dramatic or we're taking
Right.
unnecessary measures when really it's like, no, like it's good and normal to be checking in, to consult with professionals, to just be
Mhm.
curious and tender
Right.
towards ourselves. And so I love that that's clearly the mindset that you have going into it, and that you can provide that for
Oh,
the
for
people
sure.
you're working with. Um,
Yeah, for sure.
and just kind of an overview of like for someone who's never been to physical therapy, what should they expect?
Yeah, that's a great question. So basic things, we obviously have people fill out some paperwork just to give us a basic understanding of like, okay, what originally happened, what kinds of things are you experiencing right now? And then of course going through, past medical history, current medications, things like that. So when you start to meet with your physical therapist, a lot of it is just having a conversation of like, okay, what's going on? When did this start? Was there anything that actually happened originally, or did it just kind of gradually come on? What specific things are you experiencing, whether that be pain or stiffness or weakness? And then we ask pretty much about the whole body because, again, like I said, everything's connected. So if you're like, well, I'm coming in for shoulder pain, like, okay, is there anything going on with your neck? Is there anything going on with your mid back, your rib cage, anything lower down the chain? So we ask about a lot of those things. And then after getting a lot of information, then we go into what we call the objective portion of the exam. So what that looks like is a little bit more of movement screening. So let's look at your range of motion. Let's look at your joint mobility. Let's look at your muscle flexibility. Let's check out any ligaments just to make sure nothing is torn. Let's look at strength of everything. Let's look at balance. If someone's coming in saying that they are having a hard time, they have knee pain when they squat down to pick up something. Okay, let's watch you squat and see how things are moving and just see how the whole body is working together or not working together. Um, and so it's kind of looking at like breaking down some of the small pieces of things, but then also really trying to dive deep into that specific thing that you're having issues with. And
Mm.
then once we kind of have all of our subjective information, our objective information, Our goal is to come up with a specific, what we call home exercise program, that is designed based on what we find in our exam to make sure we're getting you back to your goals and the things you want to get back to.
Mm.
And so a lot of times what interventions can look like are, manual therapy. So hands-on. If a joint's not moving, let's get it moving. Let's mobilize it. What we call thrust technique. So maybe like if your low back or your neck needs to pop before we move into some exercise, we can kind of do that because that can help relieve pain, get things moving the way we want them to. um Strengthening, if something's weak, we're going to strengthen it. If something's really tight, let's stretch it, or like figure out what the root cause of that tightness sensation is. Again, from a pelvic floor perspective, our pelvic floor, especially what we see a lot in the clinic nowadays, is just pelvic floor overactivity and tension. And so like how can we down train those muscles so that when we do contract them to use them functionally, they're really efficient. So we kind of call those like motor control activities. So our job as PTs is to, one, make sure you feel empowered to know how to manage your stuff by yourself. And then two, we give you a whole bunch of things to put into your toolbox. So if you do feel symptoms a couple months down the road, you know what to pull out of your toolbox and be like, oh yeah, I know that if I do this, it helps my symptoms. And then you can just kind of keep going on with life. So our goal is to empower you so that you don't have to keep coming to PT all the time. We want you to know how to listen to your body, how to treat yourself, and then keep up with kind of that maintenance program moving forward.
Yeah. Very well said. I feel like that gives a very clear and full picture of the process. And, as someone who's been in physical therapy, I can attest to, yeah, like I've definitely done that where I've pulled things out of my pocket of the tool belt of like, oh yeah, I'm remembering what this feels like. I'm remembering kind of what usually this means and how to address that to create a sense of balance within my system to where if something is overcompensating, whether it's being really restrictive or loose, like to strengthen or stretch those areas in order to help my body function the way it needs to. So
Feel
love
good,
that.
move good.
Oh yeah. Oh yeah. Um, and tell me a little bit about just like, okay, how did you come to this whole PT world? And then if you can, would love to hear more about like what led to Rise PT coming to the area and what's kind of like the mission.
Yes, awesome. Excited to talk about that. So, I was actually a PT patient in high school. So, I
Mm,
grew up playing sports, had some pretty chronic knee pain at a young age. And so, ended up thankfully being referred by my doctor to
mm,
go see PT. So, worked in a PT clinic for a couple of months. And I always knew that I loved the human body and always loved my science subjects in school. And so actually getting to be a patient, I was like, man, this is like the perfect combination. You get to deal with the science and the human body, but you also get to deal with people and form connections and build relationships with people. It's a little different than some other healthcare providers, like maybe an MD or a physician's assistant or nurse, where you're like, okay, you go in, you get to chat with them for maybe 5 minutes and then move on to the next patient kind of thing. So
mhm,
I really liked being able to, I get to spend 45 minutes to an hour 2 to 3 times a week for a couple of months with patients, and so, like, you really get to form deep connections with people, and I think that's a really unique area that PT has a really cool influence in. Like you mentioned at the kind of beginning of this, like, we really get to advocate for our patients because we know them on a deeper level than maybe their primary care does, and we get to see them a little more often. Um, and so I really liked kind of the combination of all of that. So when I went to college, I didn't necessarily fully know what I wanted to do still. It was PT was still in the back of my mind. So I ended up, but I've always loved food. I love eating food. I love talking about food. I love all the things about food. So um yeah, decided to get my undergraduate degree in nutritional sciences, and it's been really awesome being able to incorporate nutrition along with my PT field. PT is pretty heavy exercise based, and so you can't really talk well about exercise if you don't also talk about nutrition. And so I think it's been really cool to be able to incorporate a lot of those things together to really holistically treat patients. And then I've even noticed it almost more so from a pelvic floor perspective.
Mm,
Of I mean, a lot of times people say with maybe chronic pelvic pain, they probably also have, chronic constipation, or they also probably deal a little bit with anxiety or a history of eating disorders, or I mean, a whole spectrum of things that can kind of be coming alongside of that. And so if I don't know how to address their constipation, am I really truly going to be able to help their pelvic pain or their
yeah.
back pain or different things like that? So, it's really interesting being able to like throw both of those in together, and you see a lot better results because you're treating the whole system. Um, so yeah, that's kind of, I guess, from a pelvic floor perspective. I got into it kind of just by chance a little bit, which is funny. I never really thought I was going to be a pelvic floor PT, but in PT school, we had a new professor join our staff who is a women's health specialist. And so I took her elective because my brain was like, okay, if I'm going to be treating, athletes or older adults, people with chronic back pain or hip pain, I probably need to know a little bit about their pelvic floor, so again, I can just treat the whole system. And then once I started learning about it, I was like, "Oh my gosh, like, this is game changing for a lot of people," and, like, a huge piece of the puzzle that a lot of people don't know about, especially in, like, southern states where we're just a little slower on the trend of evidence-based practice and all sorts of things. So in PT school, I did my last clinical rotation up in Portland, Oregon, where I worked with a PT who was a pelvic floor specialist, but also treated orthopedics. And it was eye opening. It was awesome. And so then once I came back here, I was like, I know I really need to incorporate at least some piece of pelvic floor into almost all of my patient care. Um, but again, there weren't that many pelvic PTs in the area. And so it was one of those that were starting to get more people asking if we offered that. And I was the only person in my clinic that had any experience or exposure to
Wow.
pelvic floor. So my boss was like, can you take these patients? So I kind of just like ended up with them. But it was really good, and I'm super thankful for all of that. So yeah. And then I guess a little bit on Rise PT. So our owners, Tyler and Derek, have worked at outpatient for a long time, and they were in one of those bigger corporate companies where you were just pumping as many patients through the doors as you could. And they were like, I think we can do this better. So our main mission is to provide excellent care with one-on-one doctorate of physical therapy treatment only, to where patients expect this level of care, which in turn will challenge other outpatient clinics to provide that one-on-one patient care, which hopefully will in turn make insurance companies be like, hey, this should be the standard because patients are getting better. This is what they expect. So this is what we are going to expect from all of our competitors, kind of thing. That's our hope.
Yeah, that's amazing. Yeah. I mean, I love that dream and that hope. And I'm like with you in that battle and hope
Yeah.
that that does like lead to bigger
Happen.
systematic change.
Right.
Yeah, so needed. And um it's incredible what you guys are doing and that we can access this in Northwest Arkansas because like you said,
Right.
being in the South, there are certain cultural things that add challenges to
Yeah,
this journey.
for
Um,
sure.
and so I love that you're bringing this informed care and that you're working with a company that is very on board with that and
For sure.
wants to give individualized care to our community. And so that's really incredible. And, for those who are interested, how can people get connected?
Oh yeah, for sure. We are pretty prevalent on Instagram. I think we're, Instagram, LinkedIn, all those kind of main platforms. And so we post quite a bit on our Instagram page. I'm sure you'll put this in like show notes and all that stuff, but it's Rise PT underscore NWA. So you can follow us on there. We also do have a Rise pelvic page as well. So if you're specifically looking more so from a pelvic floor perspective. And then you can get on our website. Honestly, if you just go into Google and type in Rise Physical Therapy Northwest Arkansas, we pop up to the very front. And so you can check out our our website, we have blog posts you can sign up for, just something that comes from one of our PTs that, maybe touches on a specific topic each week. So you can just kind of learn it that way. You can reach out to us by calling us. Putting in a submission, be like, hey, I think I want PT. And one of our staff members can give you a call to set that up and just ask specifically what you're looking for. And then they make sure that they set you up with the right PT. So a lot of our PTs within our company have different like niche areas that they are really specialized in treating. And so we want to get as much information as we can to make sure we pair you well with the right PT. But yeah, social media, LinkedIn, our website are all great resources to get connected with us.
Amazing. Well, thanks so much, Sarah. This has been a really great conversation, and
Mm.
I feel like I've even learned some new stuff too, and that's always fun for me. And so, yeah, I'm excited for what you guys are doing and how people can get connected. And so, thanks so much.
Yeah, of course. Thanks for having me.
Of course.